Good morning, and thank you for the opportunity to present. When Dr. Nuss presented his work in the American Pediatric Surgical Association meeting in 1997, there was immediately enthusiastic adoption of the procedure, and our hospital went from seeing 5 patients a year to 10 to 20 times that many. And it was very striking that when patients came to be seen, frequently the patient, 80% of the time male, wouldn't take his shirt off to be examined. He had to be told to take his shirt off for examination. And yet, immediately after operation, the patient would sit on the hospital ward with no shirt in bed because he was clearly very proud of his chest. And when he would present for follow-up, he would take his shirt off very quickly. So we were very struck by this, and trying to collaborate with others, sought out a leading figure in body image concerns at Old Dominion University, Dr. Thomas Cash, who had spent his career, he was at that time a senior figure in the psychology world, and he had looked at patients with burns and patients with various psychologic difficulties, bulimia and so on, who had body image disturbance. And we asked him, how would you convince a room full of psychologists that what I just told you about the boys is true? And so we set out to design a way of doing that in a believable way. So and I must say, again, the Korean presence in the United States increases. So we set out to do that, and in 2003 published a report of the Pectus excavatum evaluation questionnaire, which we had administered to 20 patients and 19 parents, and the psychologists had done test, retest validation and found that it was suitable. We then subsequently used that same tool in a multi-center study of Pectus excavatum involving 274 patients and 247 parents, and it showed very clearly that patients had improvement not only in body image but also in functional status after operation. Since then, we made it available through the American Psychological Association website without charge, and it has been adopted by people in other places. In particular, Chrysopolis in London adapted it for adult patients. He interviewed 20 adults and did test-retest on 5 patients, and it subsequently became known as the Nuss questionnaire for adults and has been used in various other centers. Recognizing that it was a useful tool for a number of patients, there have been several publications in many different centers on this. We wanted to look and do the same for patients with pectus carinatum, recognizing that some in the audience have done similarly. So we set out to design such an instrument, and getting with the psychologists, this time since Dr. Cash had retired, we worked with Dr. James Paulson, and rather than 20 patients, he wanted to have a much larger number of patients to establish the validity of the test. So we had to get 78 pectus carinatum patients. And remember, in the United States, pectus carinatum is not so frequent as excavatum. Then we had to validate that with another group. About 85% of the patients were male, and about 90% were Caucasian. We then, to try to develop the instrument, had 5 of the surgeons get together with the psychologists and try to come up with an item pool of 62 items for patients and 40 for parents. And then we went through and administered this, and you had to retest on each of these items. So after doing that, starting with so many, we got down to 22 items for the patient and 17 items for the parents, and this then had to be checked with the psychological people with this components factor analysis, and then they had to do this Verimax rotation, which is a vector analysis thing to see if the test was valid. So after going through all of this, they found a questionnaire with 18 items for patients and 15 items for parents. But doing it, the different categories were found to have very good internal consistency, looking at body image, the treatment motivation. Anybody that's used bracing knows that patients vary in how interested they are in using the brace. The physical limitations, and recall that many carinatum patients, as opposed to excavatum patients, don't have so much in the way of physical limitations, and then the social disadvantage. The parent questionnaire had these three things: body image, treatment motivation, and physical limitations. And in looking at this, we found that the pre and post treatment, there was significant improvement in the overall score. And in a few minutes, I'll give the results of that as a separate presentation. But I just wanted the group to know how much of a process it was to try to have something that was considered scientifically valid by the people in that specialty. Thank you for the opportunity to present.